Welcome to the Deep Dive. Today we're plunging into a really challenging and often devastating condition in cattle, bovine interstitial pneumonia, or BIP.
Yeah, BIP.
It's a tough one.
It really is. It seems like a bit of a shapeshifter,
Yeah.
Lots of names, lots of different triggers, but always, well, a profoundly impactful outcome for the animals. For this deep dive, we've waded through quite a stack of sources, everything from detailed veterinary reviews to practical farm insights.
A good mix.
Yeah, and our mission today isn't just to tell you what BIP is, but to really cut through the jargon, unravel its various forms, and pull out the crucial insights. Why is this such a significant challenge? What's the core understanding we should take away?
That's a great way to put it. What's really fascinating, I think, is that BIP isn't one single disease, not at all. It's actually a broad syndrome.
A syndrome, okay.
Right. Think of it as the lung's very specific and often pretty severe stereotypic response.
Stereotypic response. Meaning it's a predictable, sort of fundamental way the lung reacts to a whole range of different insults or injuries.
Ah.
And we'll show you how these incredibly diverse triggers, toxins, infections, you name it, can all lead to a remarkably similar pattern of damage in the lungs. And that common endpoint is why diagnosis can be so elusive and management so challenging.
Okay, let's unpack this then. Our goal is to give you a clear, comprehensive picture, complete with some surprising facts and those crucial details that really matter for understanding this whole complex issue. So let's start right at the beginning. What exactly is bovine interstitial pneumonia, or BIP? It sounds pretty technical and, frankly, maybe a bit intimidating.
That's a great question, actually, because a lot of the confusion starts right there with the name itself. In veterinary circles, you'll often hear it called atypical interstitial pneumonia, or AIP.
AIP. Okay.
And this refers to a group of respiratory diseases where the main problem, the inflammation and damage, primarily targets the lung's interstitium.
The interstitium. What exactly is that part of the lung?
Okay, imagine your lung is like a sponge, right? The air sacs are the little holes in the sponge. The interstitium is the delicate web-like material, the sponge itself, that forms the structure. It's the framework where oxygen actually passes into the blood.
Got it, the framework.
Yeah. So when this delicate framework gets damaged in BIP, fluid and inflammatory cells start to accumulate there. They thicken up those tiny air sac walls, and that severely impedes oxygen exchange. It's basically like trying to breathe through a waterlogged sponge.
Wow, okay. That's a powerful image.
Okay.
And that atypical part, that still sounds a bit confusing if it's this stereotypic response, like you said.
Yeah.
Why call it atypical?
You've hit on a really important point there. It's purely a historical term, and honestly, it's a bit of a misnomer now.
Oh, misnomer? Okay.
Yeah. Early investigators way back, they called it atypical because they saw fluid leaking into the air spaces, and they mistakenly thought, well, that looks more like bacterial pneumonia.
Ah, I see.
But we now know it's simply part of the really profound inflammatory response that's characteristic of this syndrome. Fundamentally, AIP just represents the lung's stereotypic response. It's one big, dramatic, kind of go-to reaction when it faces a variety of severe injuries.
So this is like the lung's universal panic button reaction. What does that panic actually look like on a cellular level? What's the underlying damage process?
Right, so that underlying pathological process, the actual damage mechanism, is called diffuse alveolar damage, or DAY.
Day.
It typically unfolds in two overlapping phases. The first one is the acute exudative phase. This happens pretty fast, usually in the first week.
Yeah.
And this phase is marked by widespread damage to the cells lining the air sacs, specifically the really thin cells responsible for gas exchange, called type I pneumocytes, and also damage to the small airways.
So the working parts get hit hard.
Exactly. This causes a protein-rich fluid and other inflammatory gunk, like fibrin, to leak into the lung spaces. And this leakage forms these characteristic pink, glassy structures that you can see under a microscope called hyaline membranes.
Hyaline membranes. So it's literally like a glassy film coating the inside of the breathing sacs. That sounds bad.
It is bad. They're a microscopic hallmark of severe AIP, effectively creating a barrier, blocking oxygen from getting through. Now, if the animal survives that initial, onslaught.
Which sounds like a big if.
It is a big if. But if they do, the lung then enters a proliferative or organizing phase. This is basically where the lung tries to repair itself.
Okay, and what does that repair look like? Does it work? Can the lung fix itself properly?
Well, it tries. This phase involves the rapid multiplication of the lung's dedicated repair cells called type II pneumocytes. They try to repopulate the damaged areas.
So
However, if the initial damage was too severe, or if the injury keeps happening, this repair process can actually become pathological. It goes wrong, and that leads to interstitial fibrosis.
Fibrosis, like scarring.
Exactly. Permanent scarring of the lung tissue. Think of it like trying to mend a really delicate piece of lace with thick, rough twine. It might hold the structure together, sort of, but it won't be flexible, it won't function as well. It stiffens the lungs and irreversibly impairs their ability to exchange oxygen.
Wow, okay, so that damage can be permanent even if they survive the acute phase.
That's right. It can lead to chronic problems down the line.
Now, you mentioned earlier there are a lot of different names for this condition. Bovine interstitial pneumonia. Atypical interstitial
Yeah.
pneumonia. What's going on there? Why so many names?
That's a fantastic observation, and it really drills down to that core insight we talked about.
Yeah.
This is a syndrome, not a single specific disease.
Right, the stereotypic response.
Exactly. The varied nomenclature, all those different names, simply reflects how the same fundamental pattern of lung injury, that diffuse alveolar damage, was identified independently in different situations, often based on whatever the most obvious clinical signs or pathological findings were at the time.
So different people saw the same ultimate lung damage, maybe in different types of cattle or different environments, and just called it different things depending on how they encountered it.
Precisely. It makes perfect sense when you see it that way. The most common synonym you'll probably hear besides AIP is acute bovine pulmonary emphysema and edema, ABPE,
The DBE.
which just describes two really prominent findings you often see: trapped air, which is the emphysema, and fluid accumulation, the edema. This term is most often applied to the form we see associated with pasture changes.
Gotcha. And then there's that wonderfully evocative one, but also, you said slightly misleading, fog fever. That sounds like something out of an old British mystery novel.
It really does, and fog fever is definitely a historical term. It originated in Europe, over 2 centuries ago.
Right.
It describes the acute respiratory syndrome seen in adult cattle after they move to lush, new pastures that were historically called foglands.
Foglands.
Okay. But the name is totally misleading. It has absolutely zero association with meteorological fog or weather conditions, nothing at all. It's purely about the pasture.
Huh. So no need to check the weather app if you're worried about fog fever.
Right. Forget the weather. Look at the grass. And then in intensive feedlot environments, you might hear it called acute respiratory distress syndrome, ARDS, of feedlot cattle, which links it to a very similar severe lung condition in humans.
ARDS. Okay. I've heard of that.
And then, of course, there are the descriptive colloquialisms, the terms producers and vets use out in the field, things like bovine asthma, cow asthma, panters, or even just lungers.
Lungers. Yeah, that's pretty vivid.
It really captures that distressed labored breathing, doesn't it? But the key is, all these different names, ABP, fog fever, feedlot ARDS, lungers, are all ultimately describing that same underlying pathological outcome: diffuse alveolar damage.
Okay, that clarifies the naming confusion a lot.
Yeah.
So we understand what this devastating lung damage looks like and why it has so many aliases. But the real mystery and where things get truly surprising, I think, is what causes it. What actually triggers these different forms of BIP?
The triggers. They are incredibly diverse, but we can broadly group them into 3 main categories: toxin-induced causes, infectious causes, and hypersensitivity reactions, sort of like allergies.
Okay, 3 main buckets.
Right. And a really crucial concept here, one that helps us connect the dots between these different causes and the final outcome, is the 2-hit model.
The 2-hit model, what's that?
The idea is that often there's an initial insult or some kind of predisposing condition that's the first hit. It doesn't necessarily cause severe disease on its own, but it sensitizes the lung, makes it vulnerable.
Sets the stage, kind of.
Exactly. It sets the stage for a second hit, maybe another exposure, a stressor, something else that then triggers the catastrophic, full-blown BIP response.
Interesting. Okay, let's start with the toxic causes then. You mentioned fog fever as a classic example of toxin-induced BIP. How does that specific one work?
That's spot on. Fog fever or pasture-associated AIP is probably the most well-understood cause, and it involves this fascinating biochemical cascade, all starting with something seemingly harmless.
Okay, lay it on me.
Right. So when mature beef cattle are abruptly moved onto lush, rapidly growing pasture, especially the kind you see in late summer or fall.
The rich green stuff.
Exactly. They start eating large amounts of a specific amino acid found in that forage called L-tryptophan.
L-tryptophan. Isn't that the stuff in turkey that supposedly makes you sleepy?
Exactly. The very same amino acid often gets blamed for the post-Thanksgiving nap, although that's probably more about the huge meal.
Okay.
But here's where it gets really interesting for the cow. In the rumen, that big fermentation vat, the first stomach,
Uh-huh.
certain microbes living in there take that L-tryptophan and they metabolize it, they change it into a toxic compound called 3-methylindole, or scatol.
3-methylindole.
Oh.
Okay, so the microbes make a toxin from the tryptophan.
Precisely. The tryptophan itself isn't the problem, it's what the rumen bugs do with it. This 3-methylindole, or scatol, then gets absorbed into the cow's bloodstream. It travels to the lungs.
Okay.
And there, specific lung cells, club cells, and those type I pneumocytes we mentioned have these enzymes, cytochrome P450 enzymes.
Like the liver uses.
Exactly like the liver uses to detoxify things. But here, these lung enzymes take the 3-methylindole and convert it into a highly reactive, unstable toxin. This activated toxin then causes widespread cell death right there in the lung, and that triggers the severe inflammation, the edema, the hyaline membranes, the whole DID picture we described.
Wow. So it's not the grass itself, not directly. It's the L-tryptophan in the grass, converted by rumen microbes into scatol, absorbed, and then activated into a lung-specific toxin by the lung's own enzymes. That is quite a complex chain reaction.
Isn't it amazing? It's a truly fascinating example of how intricate these biological systems can be and how something in the gut can have such a dramatic effect on the lungs.
Absolutely.
And it's not just tryptophan. Other ingested toxins can cause a very similar syndrome. For example, 4-ipomenol, which is found in moldy sweet potatoes.
Moldy sweet potatoes. Okay, don't feed those to cows.
Definitely not. Or perilla ketone from a plant called purple mint. These toxins follow similar pathways. They get absorbed and then metabolically activated in the lung to cause damage.
So the lung is kind of its own worst enemy sometimes, activating these things.
In a way, yes. And we even see synergistic two-hit interactions involving toxins. For instance, a toxin like 4-ipomenol can significantly worsen a viral infection, like bovine parainfluenza type 3 or PI3. The toxin makes the virus hit harder.
Okay, so that fits the two-hit model again. Are there inhaled toxins that can cause BIP too?
Yes, absolutely. A notable one is nitrogen dioxide, NO2, from silo gas, if cattle inhale that.
Which can happen when filling silos, right?
Exactly. It can cause a condition very similar to Silofiller's disease in humans, and the lung lesions are typical BIP that diffuse alveolar damage.
Right. Okay. So toxins are one major category.
Yeah.
What about infectious causes? You mentioned BRSV.
Yes, bovine respiratory syncytial virus, BRSV, is a major player in BIP, especially in younger cattle sometimes, but it can contribute across the board. It directly damages the lung cells.
How does it do that?
It actually causes the lung cells to fuse together, forming these characteristic multinucleated giant cells, which are called syncytia. That's where the syncytial in the virus name comes from.
Oh, okay. Syncytia.
And importantly, BRSV also acts as a facilitator, paving the way for secondary bacterial infections. It can actually make the lung cells more receptive, more sticky for bacteria like Pastorella multicida, which are common culprits in bacterial pneumonia.
Another two-hit scenario almost.
You could definitely see it that way. And another really critical infectious syndrome, particularly relevant in North American feedlots, is sometimes known colloquially as the upstairs-downstairs syndrome.
Upstairs, downstairs. Okay, tell me more.
The more technical term is bronchopneumonia with interstitial pneumonia, BIP. What you see here is a chronic bacterial bronchopneumonia that's infection, mostly in the lower front parts of the lungs, the downstairs, combined with acute interstitial pneumonia, the DIAD picture developing simultaneously in the upper back parts of the lungs, the upstairs.
Huh. That's a very vivid description. What's the thinking behind that? What's the connection?
Well, the leading hypothesis here fits that two-hit model perfectly. The idea is that the chronic bacterial infection downstairs serves as the first hit. It creates ongoing inflammation, maybe alters immune responses.
Makes the lung generally unhappy.
Exactly. It makes the lung vulnerable. Then a second hit, perhaps exposure to a low level of toxin in the feed or air, or maybe a new stressor, even a subtle one comes along and triggers that acute AIP response, the DID, in those upstairs parts of the already compromised lung.
Fascinating. Okay, so toxins, infections. That was the third category. Allergic reactions like hay fever for cows.
You're definitely on the right track. That's hypersensitivity pneumonitis. And yes, it is essentially the bovine equivalent of farmer's lung in humans.
Farmer's lung, right, from dusty hay.
Exactly. It's triggered by inhaling organic dusts, most commonly microscopic spores from certain types of bacteria, specifically thermophilic actinomycetes like Micropolis spirifani, which thrive in moldy hay, silage, or even bedding.
So mold spores are the trigger.
Right. This inhalation triggers complex immune reactions in the lung, leading to chronic inflammation, eventually chronic coughing, weight loss, and characteristic lung lesions that include tiny inflammatory clumps called granulomas, and that fibrosis or scarring we talked about earlier.
So this form is more chronic usually.
Often, yes. It tends to develop more gradually compared to the acute toxic or viral forms, though acute flare-ups can happen.
Okay, so we have toxins, infections, allergies, often working together in that two-hit way. Now, when an animal actually has acute BIP, what does it look like? What are the signs someone out in the field should be looking for?
The clinical signs, particularly in those acute cases like fog fever or feedlot ARDS, are typically quite dramatic and shockingly sudden.
Sudden, you emphasized that before.
It's truly striking. Animals can appear perfectly normal, eating and drinking just 12 hours before becoming severely ill.
So an animal could look fine at dawn and be gravely ill by noon. That must be incredibly frustrating and frankly scary for farmers and ranchers.
It really is. Many producers have shared stories. Checking their herd in the morning, everything seems fine, and by evening, they're dealing with multiple animals in severe distress. It's a race against time, often a losing one.
So what's the defining feature?
The absolute defining feature is profound difficulty breathing, what vets call dyspnea. You'll see rapid, shallow, labored breathing, very often progressing to open mouth breathing.
Open mouth breathing, okay.
And affected cattle adopt this really distinctive posture, head lowered, neck extended out in a straight line, and their elbows turned outwards away from the chest. We call that an open-shouldered stance. They're doing everything they can instinctively to maximize airflow to open up their chest.
That image really helps you visualize how incredibly distressed they must be. It sounds like they're truly fighting for every single breath.
They absolutely are, and a very common, often audible sign that goes along with that is an expiratory grunt.
A grunt?
Yes, a loud groaning or grunting sound accompanying each outward breath. They're literally forcing air out against those resistant, damaged airways.
Wow.
Now, here's where it gets really interesting and diagnostically important. Unlike many common bacterial respiratory diseases like shipping fever, acute BIP is typically characterized by the absence of a significant productive cough and, importantly, the absence of a high fever.
No high fever. That seems counterintuitive for such severe lung inflammation.
It does, doesn't it? But the body temperature is usually normal or only slightly elevated. Any slight rise is often just due to the sheer physical effort of trying to breathe, not necessarily infection-driven fever.
Okay, so labored breathing, grunt, no cough, no fever. Got it. Any other signs?
You might see frothing at the mouth just due to the difficulty breathing and maybe some edema fluid coming up, obvious anxiety, distress. And in severe cases, you might even be able to feel subcutaneous emphysema.
Subcutaneous emphysema, air under the skin.
Exactly. It feels like a crackling sensation, almost like Rice Krispies under the skin, usually over the withers or back. It happens when air dissects out from the damaged lungs and travels under the skin.
Okay, that's another very specific sign. And the prognosis for these acute cases, it sounds pretty dire based on what you said.
It is extremely fragile. Honestly, even mild exertion, like trying to move the animal gently for treatment or examination, can cause immediate collapse and death.
Just moving them can kill them.
Sadly, yes. The lungs are just that compromised. Mortality rates are high, typically ranging from 30% to maybe 60%, sometimes even higher in certain outbreaks.
That's devastating.
It is. And even for the animals that do survive a severe acute bout, they can have long-term consequences. Things like chronic emphysema or that irreversible interstitial fibrosis we discussed, leading to permanent breathing problems, poor performance, and sometimes even eventual heart failure because the heart has to work so hard to pump blood through those damaged lungs.
So it's a grim picture.
Oh.
How then do you diagnose it when an animal is still alive?
Yeah.
Especially if it's so risky to handle them. And how do you tell it apart from other common cattle respiratory diseases, given these somewhat unusual signs?
Yeah, antemortem diagnosis in the live animal is incredibly challenging, and often it has to be presumptive based on the signs and the situation.
Presumptive, okay.
The herd history is absolutely paramount. It's probably the most useful tool you have. For example, if you see sudden severe respiratory distress in multiple mature beef cows, maybe 5 to 10 days after they were moved onto lush pasture.
That screams fog fever.
Exactly. That scenario is almost pathognomonic, meaning virtually diagnostic for fag fever. The history is key. Sometimes thoracic ultrasonography can be helpful.
Ultrasound, what do you see?
You might see what are called B lines, these bright white vertical streaks on the ultrasound image that shoot down from the lung surface. They can suggest fluid buildup in the lung tissue, the interstitial edema, but it's not specific only to BIP. Other conditions can cause similar patterns. So it's supportive, but not definitive.
Okay, so history is key. Ultrasound might help.
No, correct.
But it sounds like a definite diagnosis is tough while they're alive.
It really is. The definitive diagnosis of BIP, unfortunately but reliably, is most often made through a post-mortem examination, a necropsy.
After the animal has died.
Correct. And the findings at necropsy are usually unmistakable for someone experienced. The lungs are visibly abnormal. They're voluminous. They look big and heavy. They feel wet and boggy. That's the edema. And importantly, they fail to collapse when the chest cavity is opened.
They stay inflated.
Yes, because of the trapped air, emphysema, and the stiffness from the edema and inflammation, healthy lungs deflate like balloons. These don't. They have this unique, semi-firm, almost rubbery texture.
Rubbery.
Yeah, it's sometimes described as feeling like stale marshmallows in a plastic bag. It's very different from the firm, solid, almost liver-like texture you feel with typical bacterial pneumonia, which tends to consolidate in specific lobes.
Stale marshmallows, that's powerful.
It is. You'll also often see frothy fluid filling the airways, and that emphysema, those air bubbles, might be obvious on the surface or between lung lobes. And then, of course, microscopic examination of the tissue confirms the diffuse alveolar damage, finding those hyaline membranes and the cellular changes.
This stark reality that a definitive diagnosis often comes only after death really underscores why prevention, rather than relying on treatment, has to be the main strategy for this condition, doesn't it?
That is absolutely the critical insight here. And it also highlights why it's so vital to differentiate BIP from the much more common bovine respiratory disease, BRD complex, often called shipping fever.
Right. How do they differ again, just to be clear?
BRD is typically an infectious process, often hitting younger, recently weaned calves, maybe stressed from transport. It's usually characterized by obvious signs of infection, high fever, depression, loss of appetite, and often a productive wet cough. And the lung lesions in BRD are typically concentrated in the lower front lobes, the cranioventral parts.
Okay, so fever, cough, younger animals, front lower lungs for BRD.
Generally, yes. BIP, on the other hand, often affects older, sometimes more valuable animals like adult cows. It crucially lacks that high fever and prominent cough in the acute phase. And the lung pathology is diffuse, affecting large areas or concentrated in the upper back parts, the caudodorsal regions.
Different pattern, different signs.
Completely different picture. And misdiagnosing BIP as BRD and just reaching for antibiotics thinking it's a standard bacterial pneumonia that's going to be futile, costly, and won't address the underlying DID process.
Makes sense. Given how devastating BIP sounds, how difficult treatment is, and how tricky diagnosis can be in a live animal, I'm definitely guessing prevention isn't just important, it's really the only effective game in town here.
You are absolutely spot on. Prevention is paramount because therapeutic interventions trying to treat severe acute BIP, well, they're notoriously unrewarding.
Why is treatment so difficult?
Because by the time those dramatic clinical signs appear, the lung damage that daddy is often already severe and, frankly, irreversible. You can give supportive care, maybe anti-inflammatories, sometimes diuretics, but you can't undo the damage that's already done. Many animals will die despite the best treatment efforts.
So managing a sick animal is more about damage control.
And minimizing stress. That is the single most important principle in managing a clinical case of BIP. Minimize stress. Any handling, any exertion, as we said, can precipitate immediate collapse and death. So if you have a suspected case, it's often best to disturb them as little as possible.
Just leave them be, if possible.
Often, yes. Which again points us straight back to prevention.
Okay, so if treatment is so challenging, What are the key prevention strategies? What can people actually do?
Right. Prevention strategies are crucial, and they absolutely must be tailored to the specific suspected cause or the specific situation.
Makes sense. You prevent fog fever differently than the feedlot type?
Exactly. So for fog fever, or that pasture-associated ABPE, it's all about managing that transition onto lush forage. There are a few key things.
Okay, like what?
First, gradual introduction. Don't just turn cows out onto that rich pasture overnight. Introduce them slowly, maybe for a few hours a day, over a period of 10 to 14 days.
Why does that help?
It allows those rumen microbes we talked about to adapt gradually. They don't get that sudden massive load of L-tryptophan all at once, so they don't produce that huge spike of toxic 3-methylindole.
Okay, let the gut bacteria get used to the new diet slowly.
That makes sense.
What else?
Second, dietary management. You can supplement the cattle with dry hay while they're on the lush pasture, or limit their grazing time each day. This effectively dilutes their intake of L-tryptophan.
So they fill up partly on hay, less lush grass.
Right. And third, there's a very powerful tool available using ionophore feed additives.
Ionophores, like monensin.
Exactly. Products like monensin or lossalocid. These can be fed daily, usually mixed in a supplement, starting before and continuing during the high-risk grazing period.
And how do they work for preventing fog fever?
They work by selectively inhibiting those specific rumen bacteria that are responsible for converting L-tryptophan into the toxic 3-methylindole. They basically stop the toxin production at the source. Studies show they can reduce 3-MI formation by as much as 90%.
90%. Wow, that's a really significant reduction. That sounds like a very effective strategy for fog fever.
It is. It's probably the most effective single tool we have for preventing pasture-associated BIP.
Okay, so that's pasture management. What about prevention for the infectious forms or the kind of BIP we see in feedlots?
Right. For infectious causes like BRSV, vaccination is really a cornerstone of prevention. There are good vaccines available. Modern modified live virus vaccines, MLVs, are generally considered pretty effective, especially if given at the right time before exposure.
So vaccinate for BRSV.
Yes. And more broadly, having comprehensive vaccination programs that target the whole BRD complex that includes common respiratory viruses like IBR, infectious bovine rhinotracheitis, BVDV, bovine viral diarrhea virus, PI3, and also key bacteria like Mannheimia hemolytica that's also essential.
How does vaccinating for other respiratory diseases help prevent BIP?
Because reducing the overall burden of chronic respiratory infections helps prevent that first hit we talked about. If you keep the lungs healthier overall, they're less likely to be vulnerable to a second hit, whether that's BRSV itself or a toxin or stress that could trigger the BIP syndrome.
Ah, okay. So keeping general respiratory health up helps prevent the lung from being vulnerable to that secondary catastrophic event.
Precisely. It's all about reducing those risk factors. And beyond vaccination, general environmental and feed management are also really key.
Like what specifically?
Well, obviously, avoiding feeding moldy or spoiled sweet potatoes.
Right. No 4-ipomenol.
Controlling toxic weeds like purple mint in pastures, and particularly in feedlots, ensuring good pen maintenance, adequate ventilation to reduce humidity and airborne pathogens, and controlling dust levels, which can be irritants and carry microbes. All those basic husbandry practices contribute.
So it's a combination of targeted strategies like ionophores or vaccines, plus good overall management.
Absolutely. It requires a multifaceted approach.
This deep dive really makes it clear that bovine interstitial pneumonia isn't just one thing at all. It's this complex syndrome, often acting as kind of common endpoint of lung injury that can result from a whole variety of distinct causes, whether they're toxic, infectious, or allergic.
Exactly. It's the lung reacting in its characteristic severe way to different insults. And what's truly fascinating, and perhaps the most critical concept to grasp, is that underlying two-hit paradigm.
Where an initial condition, maybe seemingly minor, or a sudden change in environment or diet, can set the stage, making the lung vulnerable to a subsequent catastrophic outcome from a second trigger. Understanding that really shifts the focus, doesn't it?
It really does.
It shifts the focus away from just trying, often unsuccessfully, to treat severely sick animals towards proactively managing risk, identifying those potential first hits and second hits, and doing everything possible to prevent the disease from occurring in the first place.
That makes so much sense, especially when you consider how fragile those affected animals are and how challenging, how often unrewarding treatment can be. The undeniable takeaway here really is prevention, prevention, prevention.
Couldn't agree more.
So what does this all mean for you listening? Well, hopefully, understanding the nuances of BIP, its varied triggers, its distinct presentation compared to common pneumonia, the concept of the two-hit model helps you appreciate the really complex challenges involved in animal health. Yeah, it really highlights the incredible intricacies of biological systems. I mean, just think about that fog fever example, how tiny microbes way down in a cow's rumen can metabolize something from grass in a way that ultimately leads to devastating toxic damage way up in the lungs. It's quite amazing biologically.
It really is. The interconnectedness is stunning.
And maybe this raises an important question for you to consider, just to reflect on. How might this two-hit concept, this idea where seemingly minor stressors or exposures can amplify the impact of a subsequent, perhaps more severe challenge, how might that apply not just to cattle lungs, but to other areas of health, or even to complex systems, challenges, or projects in your own life?
Hmm. That's a really interesting thought to leave us with, that idea of vulnerability and combined impacts. Well, we hope this deep dive has given you a much clearer picture of this challenging condition, bovine interstitial pneumonia, and perhaps sparked a few aha moments about the complex interplay between diet, microbes, environment, and ultimately health.
Hope it was useful.
Thanks so much for joining us for this deep dive.